Hello everyone, Vince Cerilli here with the Medicare Coverage Network. And here we are today with our first in a series of videos that we'll be sharing with you to help you understand about Medicare and the Medicare plan options that are out there in the marketplace. This first one, called Medicare 101. Here we'll be just talking about the basics of Medicare, how to enroll in Medicare, the different parts, the 4 parts of Medicare, and then what Medicare covers and what Medicare doesn't cover, which is important too because you need to understand the gaps in the coverage of Medicare so that you can then understand what you're going to need to do in the marketplace as far as choosing a plan option that'll be packaged together to give you a full comprehensive program. So without getting into too much detail about that, let's just jump right into our first video, Medicare 101. Okay, here we go, Medicare 101, our first video. Here's what we're going to review today. First of all, we're going to talk about properly enrolling in Medicare. Next, the 4 parts of Medicare. And then we're going to follow that with what Medicare covers and what Medicare doesn't cover. So let's jump right in here. When do I sign up for Medicare? Well, you should contact the Social Security office at least 3 months before you turn 65 to make sure everything is rolling in the right direction. And we highly recommend 3 months, at least 3 months before you turn 65. So you can contact the Social Security office, or as I did, you could go online and apply for your Part A and Part B at www.socialsecurity.gov/retirement. And it's really easy. Just follow the prompts. Any questions, you can call their 800 number or call us at 888-497-6733. So let's talk a little bit now about the initial enrollment period. Your initial enrollment period is when you can first sign up for Medicare, and it's really a 7-month period that begins 3 months before the month you turn 65. It includes the month you turn 65, and it ends with the last 3 months after you turn 65. So that puts your 7-month window into play for your initial enrollment period, where there's no penalties and everything will go smoothly if you apply during those 7 months for your Part A and Part B. Some people actually automatically enroll. Most people don't, but some people automatically are enrolled in Part A and Part B. For example, if you received your Social Security benefits at age 62, you'll be automatically enrolled in Part A and Part B and get your Medicare card 3 months before you turn 65. Also, if you're under age 65 and are collecting disability benefits, you'll be automatically enrolled, as well as if you have ALS and Lou Gehrig's disease, you'll again automatically be enrolled in Part A and Part B. But for the vast majority of us, we'll have to go online or call the office or go down in person to enroll. So if you sign up during the first 3 months of your initial enrollment period, in most cases your coverage will start on the first day of your birthday month. But if your birthday month is on the first day of the month, your coverage will start the first day of the prior month. So just a little precaution there, but that's just to get everything moving in the right direction. If you enroll in Part A or Part B the month you turn 65 or the last 3 months of your initial enrollment, the start date of your Medicare coverage will be delayed. And we don't recommend that at all. We just get started early on this, at least 3 months before you turn 65, and everything will be put into place, your Medicare coverage on time. Let's talk about a special enrollment period. Now, if you or your spouse are still working and you have a chance, you still have a chance to sign up for Medicare during a special enrollment period. Now, if you didn't sign up for Part B when you were first eligible, because again, you're covered under a group health plan with your employer, where either you or your spouse are still working, you can sign up for Medicare Part A and Part B anytime you're still covered by that group plan. Or what most people do during that 8-month period that begins the month after your employment or your group health plan ends, whichever comes first. That's actually the case for my wife. She's still on a group health plan, so she still qualifies under a special enrollment period, and so all her Medicare Part A and Part B rights are still intact and will be unfolded during your initial just as if it were an initial enrollment period, but it's called a special enrollment period. But if you didn't sign up during for your Part A during or for your Part B during your initial enrollment, and you don't qualify for this special enrollment period, then you're going to have to sign up between January 1st and March 31st of any given year. So your coverage won't start, and also your coverage won't start until July 1st of that year, and you may have to pay a higher premium for that late enrollment. So we really urge you to get started early on this, at least 3 months before you turn 65, so you can avoid any penalties and higher premiums and any lack of coverage or gap in your coverage. So are you enrolled in Medicare? If you're automatically enrolled, you're going to get your card at least you're going to get your card 3 months before you turn 65. It's going to look like this. As for the rest of us, if we weren't automatically enrolled and just did it during the 7-month window, obviously the card is going to be the same. This is what your cards are going to look like. So let's now talk about the 4 parts of Medicare. They're labeled Part A, B, C, and D. Hospital insurance, medical insurance, Medicare Advantage, and then your prescription drug coverage. Let's talk about them now individually. Your Medicare Part A hospital coverage covers these coverages here, these benefits. Inpatient care in hospitals. When you're checked into a hospital, it's covered under Part A. Any skilled nursing facility care as well. Anytime after you had an inpatient at a hospital and you needed additional skilled nursing and you had to be checked into a skilled nursing facility, that's covered under Part A, as well as hospice and some home health care as well qualifies under Part A. Now Part B is your medical insurance, and that's typically services provided by doctors and other healthcare providers in an outpatient capacity. So outpatient care, if you had to have some minor surgery or something to be done in the morning and it doesn't require hospitalization, you're home in the afternoon, that's called outpatient care, and it's covered under Part B. Home health care is also qualified under Part B, and there's details to that. Durable medical equipment and then many other preventative services are covered under Part B. We'll go into more detail in future videos about some of these services, but right now we're just trying to give you a basic understanding of what coverages are covered under which part, Medicare Part A or B, C or D. Next, Part C. This is what's called Medicare Advantage. Now, Medicare Advantage is actually run by Medicare-approved private insurance companies that follow the set rules by Medicare. So in essence, they're covering and taking care of you if you choose a Medicare Part C. And again, we'll go into this more detail in future videos, but you have the option of choosing a Medicare Part C, called Medicare Advantage, or a Medicare supplemental plan, which again we'll go into in future detail in future videos. But if you chose a Part C, you're assigning your rights to your Medicare Part A and Part B benefits to a private insurance company, and then they will provide you the care for all your Part A, Part B, and Part D services, your Medicare drug coverage. So it includes all the same benefits as Medicare A, B, and D. It's just provided directly by a private insurance company. Medicare Part D is your Medicare prescription drug coverage. Now, obviously, this helps cover the cost of your prescription drugs. It's run by Medicare-approved private insurance companies that, again, follow the set rules by Medicare. And it will help lower your costs of drugs and help protect against future costs as well, future increases in drugs. Let's talk a little bit about what Medicare covers and what Medicare doesn't cover. So let's start with Part A, hospitalization services. First of all, Medicare pays, we broke this down to what Medicare pays and what you will have to pay in this chart. So for the first 60 days that you required hospitalization, Medicare will pay all but $1,316, and that's your Part A deductible. So Medicare will cover your private room, a semi-private room, and certain services to do with the hospitalization in full, except for the Medicare Part A deductible during the first 60 days. As we roll forward, if you still required hospitalization in the 61st through 90th day, then Medicare will pay all but $329 per day, and you'll have to pick up the $329. As we roll forward to the 150th day, all but $658 is covered by Medicare, and then you'll have to pick up the $658. After that, between rolling forward to additional 365 days and beyond your 365 days, Medicare is not covering any of it. It's going to be covered. You'll have to pay for that. And again, don't worry about what you're paying here at this moment in time. What we're trying to explain here is what Medicare covers, and then what eventually either your Medicare supplemental plan will cover or Medicare Advantage coverages. So what we're trying to do here is just distinguish between what Medicare pays and where their coverage ends, and where you will have to be responsible and have to cover that with additional insurances. So Part A services, as far as they cover nursing, skilled nursing facilities too. Now the first 20 days, Medicare will pay all approved Medicare approved amounts, and you don't have to pay a cent. Now once we get into the 21st through 100th day, then all but about $165 a day is covered by Medicare, and you have to cover that 165 days again. Medicare supplemental plans and other optional benefits that are out there in the marketplace, which you have the ability to purchase, will be covered under this under the You Pay section of our chart here. Let's talk about blood under Part A. For the first 3 pints of blood, Medicare does not cover. It's covered. You have to pay it, and it's covered under a Medicare supplemental plan. But after that, any additional under Part A, while you're in a hospital, any additional pints of blood will be covered by Medicare in 100%. You don't have to pay a cent. Let's now talk about Part B services. The first thing that we'll talk about is the Part B deductible. Medicare does not pay your Part B deductible, so you're responsible for your Part B deductible, and in 2017, that's $183. Now, the remainder of the costs that are qualified under outpatient services under Part B, Medicare typically pays about 80%, and you're left with the responsibility of the final 20% for all Medicare approved amounts. Now, under Part B, if you need blood, under Part B services, then again, it's very similar. Part B covers the first 3 pints are not covered by Medicare, and you have to cover the cost at 100%. After the first 3 pints, then it falls back onto the way Medicare Part B services are covered under Medicare at 80%, and you cover 20%. One thing, clinical labs, things like blood tests and urine analysis, and those types of clinical lab tests are covered at 100%. You don't have to pay for those. But other types of tests, as MRIs and X-rays and so forth, they fall back under an 80-20 split between Medicare paying 80% and you paying 20%. Now, home health care qualifies under Parts A and B, and typically medically necessary skilled care services and medical supplies, Medicare does pay 100% of those, and you don't pay for that under a home health care scenario. Durable medical equipment falls under your Part B deductible, where you are responsible for the first $183, and then after that, durable medical equipment will be covered at an 80% by Medicare and 20% by you. So that's kind of a real high overview of what Medicare covers under Parts A, B, and C, and D, excuse me. So what we'll talk about next in the next module are the details that we just went over about what's not covered and what would be covered under Medicare supplemental plans versus that Part C or Medicare Advantage plan. So we'll compare those for you and share with you the pros and the cons of going in one direction or another, choosing a Medicare supplemental plan to help cover what Medicare does not cover, or choosing a Medicare Advantage plan and having a private insurance company cover all your needs under A, B, C, and D, Medicare Parts A, B, C, and D. So those will be debated and compared for you in future videos. But for right now, we just want to give you a basic understanding about what Medicare is about, all the parts to it, and how to enroll. So again, contact us at any time. There's our number, 888-497-6733. We can provide you with a free consultation and quote on any Medicare supplemental plans. Or you can reach us as well and find out more information about us and Medicare on our MedicareCoverageNetwork.com website. So please, don't hesitate to call us again at 888-497-6733 or get in touch with us through our website, MedicareCoverageNetwork.com. Thank you very much.